Hello, my name is Brooke, and I work in the informatics department at Memorial Hospital. And today I'm going to be taking you through our inpatient system called Quadramed, or you might also hear it called QCPR. And QCPR is our inpatient system. It also is used for our outpatient procedures and all of our diagnostics. So as we can see here, I'm logged in, and I know who I am logged in as. uh, Down here. So this should always say your name. If this does not say your name, that means your account wasn't linked properly, and please reach out to informatics as soon as possible. Now, I am not Brooke Forrester. I am aliased in as her to do this demonstration, but please always double check this. When you log into Quadramed in the surgery department, as you can see here, you're going to see your same-day surgery patients listed, operating room patient listed, and your PACU. And this is to show where the patient is located as they go through the surgery department. And before we go into a patient's chart, I just want to go over some of these icons. This main desktop is big house, big picture. So if you ever get lost in a patient's chart, this big house up here is always accessible, and you can click on that to take you out to this main desktop area. Patient search is essentially that. There's different ways to search the patients in our Quadramed program. Also, this intranet will take you directly to our hospital's intranet if you wanted to find resources for lip and clot, things like that. Over here, this is your current location check-in. This is when a patient gets admitted. This is what's used to move the patient from same-day surgery to operating room, then to PACU. So we'll go over that. Also, feel free to, this whiteboard up there, that is going to be in your department. And then you are free to explore these other icons as well. And I will return to those shortly. Now, let's go back to this patient search option. If we're going to look for our patients in Quadramed, we have a couple ways to do so. As you can see here, if the patient is registered and checked into the room, you would see them listed here. And you can always just click on the patient here. If you didn't see them here, there's a couple ways to search via this patient search option. I clicked on that, and as you can see, it defaults to inpatient observation patients that are active. This can be opened more so to, you can just go to your unit default. You can choose specific active inpatient observation. You can also just go to all patients or active outpatients. So there's a couple ways you can filter that. And to search those patients, we can put their last name, comma, first name. So if this was John Smith, that would be quite a substantial search. So we don't advise that, but you can do the last name, comma, first name. You can also do the medical record number, which is going to be a 9 number, or a visit number, which is going to be an 8 number. If you're going to search by visit, you place a V in front, V as in Victor, and then you would put that 8 number in there. You can also search using a wildcard. So let's say if the patient, you knew half of the patient's last name, you can put the beginning of that last name. So if it was test, and but before I put the T, this was a different name, of course, I'd put a dash, and then I could search that way. And that would pull up the patients with that those letters in that order in your patient search. So the wildcard is a dash. And again, that just like I just showed you, it's going to search anything before that dash. So I just use dash to open up everybody. And that's because I'm in this dev environment. And if you did it in the live environment, it would open every patient or list every patient in the system. So please just use that dash if needed. And as you can see here, we have one patient in our dev system, and that's when I put that dash in, that is what pulled up this patient. To close that, I could simply choose this X, or we could go from here into the patient chart. We have this 8 number here, but this is in dev. So this would be your 9 number, medical record number. This would show the number of counts, and then of course some other identifiers here. Now let me go just ahead and close that, and we go back to that main desktop. So I'm going to just choose to access my patient here by double clicking, and it's saying that is recording chart access, of course, so I'm going to say yes, and then we're going to go into this patient's chart. As you can see, we still have this big house up here, big house, big picture, and immediately under that, we have this little house, little guy. So little house, little guy is the patient level, and we'll go over these tabs and such. And as you can see here that we have this patient listed. So if I ever got lost, I would just simply go back to this main desktop house. And if I didn't want to quite close my chart yet, I can go back into this patient's chart by simply clicking on that. So as you can see here, we have our patient identification. We have this location here, and that location is significant, especially for surgery, because if the patient is housed on medical floor, but they're currently in the surgery department, then that's how that current location works so well. So we have a status of active, and then we have this location in same-day surgery in number 3, and that's indicated by that S there. When you log into the patient records, you're going to default to this inbox tab, and this is where you're going to see your orders, maybe some critical or abnormals, any results that you would like to observe, and you can simply access these by these different groups here and clicking on them, and that would bring these 2 items here, which is results to review. And notice that these both say complete, but they're bolded and underlined. That's because they're abnormal. So in order to look at these and sign off on them, I'd simply double click, and that would take me into that order. And at this point, I could choose to accept final review, and that shows that I reviewed that order. So I'm going to go ahead and do that there, and then that clears that out of your inbox. We always advise nurses, especially with these orders, to review them thoroughly before you sign them. So if I just clicked on this column here, which is orders to review, number 41, it pulls in all the orders as a total, so across all categories. And this would also open up any kind of opportunity to look at these indicators or advisories. So if we wanted to look at this order for glucose level, I would simply click. This gives me the frequency of the specimen, and this information gives me the time and who's placed that order. And as you can see, we couldn't really see anything on the previous screen. So if there was any additional comments or anything like that that the doctor had placed, you wouldn't have been able to see those. So always go into your orders and accept them so you can read the whole order. If I choose to accept, then that one goes away. So that is your inbox here. I'm just going to close it. Next to your inbox tab is your document tab. This is going to be for things such as event time corrections, in which you'll learn more as you get to the floor. This IVAR is going to be where you hang your IV medication, and this MAR is going to be where you place give those PO meds and some different scheduled orders. So IVAR is for hanging your IV solutions, some drips, things like that. MAR is for the scheduled orders for your PRN meds and continuous meds. So these would just list here. And then if you see this REV here, this just means that the pharmacy has not reviewed the order, but you can still give that order. You're going to get a lot of experience on the IVAR and IMAR as you begin to work with your preceptor, or whoever is assigned to work with you. And we do the bar coding, the scanning. So I will not try to demonstrate that here as it could be kind of tough to do and it might just be confusing. Overview tab is here. This is just some background information that is easily accessible that you don't have to dig for, such as maybe a pharmacy that was obtained during admission history, or a nickname that they prefer, or a religion. So if the patient admission history and other things indicated here as far as labs or activities, they've been documented. This is a quick way you can see those things in the space sheet. Order displays, our next tab. This is just going to show you all the active orders for the patient. And if you don't see a specific order that you thought may have still been active, or if you want to know if it's been completed, you can just simply hit this expand button here. And as you can see, it'll show all the expired orders, etc. If you wanted to click on an order at this point, you could simply double click, and then that takes you into that order profile. And you can review that there. All right, so I'm going to just close out of this, or I can choose to hit back. So I could choose to cancel. Okay, you're back. So if I hit cancel, that's just going to take me out of that window there. And then here's just some other face sheet information for the preoperative information, the times, the people, and the cumulative data. And you can only view information here. This wound ICG is if patients do come in with a wound, this will stage the wound over time. And it's real neat to see when it can show progression of care. Under these patient shortcuts, here's where you're going to be spending the majority of your time. Chart review is a filing system for the patient. So it's based on category. As you can see here, we have these headings, patient care, patient information, and as we scroll down, there's many more. And you can choose to look up information in chart review, and if you're going to get report, this is generally where you would do so. If you choose all events, that's going to pull out anything and everything that was scheduled or completed on the patient. Or you can do a search. So if I choose procedure down here, by clicking on that button, and I type in hemoglobin, because that's something I want to look for, I'm going to use my dash, heme dash, so that those wild cards can pull what's between them, anything that's titled. And as you can see, we pulled in everything with heme in it. So if I want to take a look at this, I just simply double click, and then that takes me directly to that hematocrit. It looks like we have 2 in progress and 1 complete. So I'd like to click on the one that is complete, and I double click. Here we have that hematocrit level. Also in Quadramed, as you learned to work through Quadramed, you will notice this transaction line. Quadramed is asking and telling you what to do through this transaction line here, even though the information's above it. So if you see such things down here, let's see, advisories or orders, you're welcome to click on those items and view that information. Also, you can trend. So if this trend option is here, you can choose to trend, and that's going to pull in all the hemoglobins that the patient has had, and you can get that trending progression over time. So you can search via procedure, and you can also trend items if that trend button is available. If it's grayed out in chart review, that means there's nothing in there. And just a quick note, if you're receiving a patient from the emergency department, if they have not signed their notes or their documentation, you will not get that summary until they do so. So this will be grayed out, the ED summary, which is our T systems. And now going next down the line, let's go to order management. Order management is where you're going to place either direct orders that a nursing can do so, or here we have our written, oral, or telephone, and then we have this protocol. Now, just keep in mind, if you indicate a written order, there has to be a written order that is scanned in. If you take a telephone or verbal, the system will ask you to do that read back, and the doctor will sign off on those orders. So let's go ahead and do a verbal. So I chose verbal, and then I'm going to choose which doctor. This will generally populate with the doctor who is seeing the patient, so you would just choose that order author. Then I'm going to come down in here and choose OK. And this is going to take me into order selection tab. And as you can see here, this defaults to same-day surgery information or orders. So all these admission documents, any head to toes, these menu options here are to guide and help you. Many times we place a lot of things in these admission documents when you order them. So we suggest using everything off of this menu so you get everything you need. But let's go ahead and just simply do a diet. So we're going to do a clear liquid diet. And to do so, I just simply click on clear with liquid. I could choose more than one option as well. And then I'm going to choose to add order. And now it's taking me through that order profile. And the first question on the order profile is, what is the reason why is the the patient here. So I'm welcome to choose the problem that they've been diagnosed with. Then I'm going to hit OK. And OK one more time to get past that. And as you can see, the frequency is set up to default with each meal, and the diet type is set up as well. But if you wanted to fill out any of these other fields, you could certainly do so, or if you had any comments from the provider, etc. So we don't have any comments. And the reason, again, I know that it's asking for comments is because of this enter comments here. I'm looking at my transaction line, even though my cursor's up here blinking. I'm going to choose to hit OK. And because I took a verbal, here's that read back. So I'm going to choose to do my read back option there. And I'm going to hit OK again. And now we can see that we have an order pending. In Quadramed, if you do not get to an accept button, then that never happens. So keep that in mind. We have not got to an accept button yet, so that order has not gone live. But before we get to that accept button and accepting that order, I just want to go over here a tab, this order history. This is where you can find all the active orders in order management. So notice we see active here. If you wanted to update that, you could do all, and then you would choose to update here, and all would, of course, pull in those expired or done orders. If you see something that like this is italicized, that means it's a secondary order to a primary. So if you needed to modify orders from here, you simply click on the order and it gives you an option to change or discontinue or hold. So if a provider calls in and says, I want to stop the aspirin, I want to stop something, then this is where you could go to simply discontinue or change that. If you're trying to stop something, change or discontinue one of these italicized items, you would have to go to the primary. So if I were to choose to click on this italicized order here, the cardiopulmonary ventilator maintenance, I'd simply double click. And as you can see here, it pulls in all this information for us. We do have an opportunity to do an audit trail, but as we can see here, this is secondary to the cardiopulmonary ventilator setup. So if you needed to change or discontinue an order for the maintenance, you would have to do that by clicking on the actual cardiopulmonary ventilator setup to affect that order. If that doesn't make sense, that's okay. It will once you start working in our system. Okay, so we have this still up here pending. In order to get that to go live, I have to choose to do an order summary first. Order summary just gives you one last ability to review, and granted, this would probably be a lot more orders listed here, but you could do your last edit order, edit frequency, or if you need to remove it, and then we would choose to accept order here. Once we hit that accept, now that order is active. Okay, specimens, you guys won't be using this vital signs trend here. Feel free to observe. This will just show you the vital sign trends over time as they're documented. Same with orthostatics. If that's ordered on the patient, this would be trended here. Very important to the surgery department and going through the surgery department is this unscheduled documentation. Unscheduled documentation is everything a nurse can document without an order, so standard nursing care. You're able to go into these things, and if you needed you want to put an extra set of vitals or height and weight, you would simply go under these titles here to do that. But notice at the top we have specialty documentation and we have surgery specific. So surgery specific, I'm going to choose by double clicking, and now we have our unscheduled documentation items, basically anything that we would want to chart intraoperatively. So you're going to see your intraoperative record here, any transfer summaries, some catheter bundle, moderate sedation, phase 1 ongoing, phase 2. So many times you're going to grab these notes here to document that patient care. So let's go ahead and click on this pre-surgical checklist first. So I'm going to double click. Now it's looking at my transaction line is saying, what times would you like to schedule this? I'm going to choose now and OK. And now this is going to take us into that pre-surgical checklist. And again, we're blinking up here, but this is asking for a date of surgery. So you can use things like today. So I'm going to choose today and enter. Emergency case, again, we're looking at our transaction down here. I'm going to say no. Procedures, this is a free text, and we know that again because of this transaction line that now says free text. So I'm just going to simply put testing and enter. Skip case, I'm going to put it, I can choose to click on no or choose N for no, and okay. Checklist. Now, we just went into that field that said checklist, and it opened up a much bigger field here, and it's asking us to choose D to document the checklist. And this is what you would go through, these questions as you filled out your pre-surgical checklist. So I'm going to look at my prompt down here, and I'm going to try to use most of my keys. So has the patient been NPO? I'm going to say yes. I'm going to put Y and enter, or basically yes and enter. Allergy band on, yes, enter. ID, on yes, enter. And then as you can see, we go through, we answer these questions and continue this documentation. Let's say I finish this and I want to get past all this. So I'm just going to choose to hit go to real quick and okay. And then it asks us, do you want to do another checklist? No, we don't. But if we did, we choose D to document. So I'm going to choose okay here. And then that takes us back to that outside part of the note. As you can see, it's asking for patient diabetic. I'm going to choose no. Any comments? If you don't have any comments, you can skip it. And then as you can see here, when I enter, it says accept as partial. So you can do that. And if you accept as partial, it will keep the note as partial. So you don't lose your documentation. You can go back to it, but in order to actually complete that note. As we can see, there is some bolded items here. Anything that's bolded is required. So if you're unable to accept a note or get to the complete the note, you might be missing one of these bolded required fields here. So double check that. So I'm going to go ahead and choose accept as partial here. And now that goes away. Now, as you can see, it took us back toward this orthostatic. Each time you open up something in a patient's chart, it lists here. So we advise that you X out of these. If you X out of this actual training RT, it'll close the whole thing. But you're welcome to close the things that you have been in so you don't get confused. So I'm going to simply choose to close those. So that's unscheduled documentation. Again, you're going to be spending a lot of time, and where you're going to be spending a lot of time is in the surgery-specific folder here. So feel free to take a look at that. And next is going to be our work list. This work list is essentially that. As you can see, we have all our scheduled items here. If we wanted to hit this expand button, that would show all the orders for the nursing staff that have been completed. So if we wanted to look at an order or something on our work list that's scheduled for this time, we would look at the date and time, and we can find that here. So it is Sunday the 28th around 4:30 in the afternoon. So we would look at 1629 here. As you can see, we have that pre-surgical checklist that's now partial. If we wanted to click on this hourly rounding, we could certainly do that, and we could document it from our work list. So I'm going to choose to double click on our hourly rounding, and it's showing me the frequency here for this hourly rounding, and that gives me the opportunity to document, cancel, or reschedule. Now, if we document that, it's going to timestamp it, and it will take us off our work list. But let's say the patient is asleep, or they have been transferred to radiology, and you're going to wait a couple more minutes before they come back. You can cancel this order, but we really advise you not to do so. Canceling an order can usually be avoided if we can reschedule it. If you want to cancel an order, just know that a lot of times that looks bad in the audit. Make sure you're never canceling something the doctor is asking you to do. So canceling is a go-to, but it's not the best. Rescheduling allows you to reschedule that, that actual order in 30 minutes. So we always advise you to please reschedule. So let's say we wanted to reschedule this one. I'm going to choose to reschedule, and then it's going to give me my options as to why, or we can do a freeze tag. So I'm going to put testing and enter. And now it's asking for the reschedule time. So let's say I want to do it in 30 minutes or at 5 p.m. So I'm going to just put 1700 and then OK. And then I get to accept my reschedule. Now, if we go to the work list, we didn't have to cancel anything. So we still are going to stick to our hourly rounding. But as we can see here, now we have our hourly rounding at 1700, and we can document that when we're ready. Going back into this partial note, we can simply do that as well by double clicking. We're going to choose D to document. That opens this back up. And let's say I want to put in information under this number 9 here, arrival to surgery department. I click in that field, and I'm going to put a now and enter, and that'll pull in that time. And then there's another field here that's required, and this is where I would add the OR, the name of the OR staff that I gave handoff to. In order to do that, I'm going to choose A to add, and then I'm just going to choose my name, FAND, and search with that wildcard. Choose my name there, and let's say that's the only person I gave a report to. Then I'm going to hit OK, and OK one more time. And it looks like we have all our fields done now. So now we can do an accept to complete this note, but we could also still come back to that. So if you're not quite sure that the note was fully done and you wanted to maybe make some critiques, keep it as partial until you're done. And accept there. And now that has come off our work list. It's no longer listed. So that is your work list. And many find it very helpful and handy to work off your work list to make sure you get things done at the right time. Consolidated medication list. This is our next thing under our work list. This is just going to show you their home visit and maybe some discharge meds if there's any, but mostly your home and your visit meds. So this is just observing information. General patient education. This is the CRAMES. This is where you're going to find how to educate your patient on their medications and or procedures. So it's asking for the date and time that you were going to educate or did educate the patient. So I'm going to put now and OK. And then it's going to take us through that education topic, the method, and any of these items that were used to provide education. Monitor data capsule, you'll learn with staff if you will indeed use that. Here's that check-in option again. So let's take a look at what this check-in option looks like. So it's asking you for the date and time you want to check the patient in. So I'm going to say now and OK. And then it's asking the status. So we know we're going to check the patient in, but now let's say we want to check the patient into PACU. So I'm going to choose to expand because the transaction size asks to enter location name or scan barcode. I'm not going to do either of those, and you might be able to do those on the floor. I'm going to choose expand, and then I'm going to choose PACU, and then accept. Now keep that in mind. The patient was in surgery 03, but we just currently checked them into PACU. So let's go take a look to see what it looks like on the main desktop now. I'm going to leave all this here, but I'm just going to click on my big house. And then what I'm going to do down here, and these are hard to see, but you can make these bigger if you use these prompts. But what I'm doing right now is simply clicking in this field. As we can see, my cursor's flash in here. I'm going to just choose enter. And enter up here real quick. And then enter down here real quick, which this one's I'm going to have to make bigger. But as you can see, that patient's no longer in there. And they're not in the other one. So if I choose to simply hit enter here, now we can see that that patient is now in PACU. So if you move a patient, check them into another location, just remember to refresh this screen by hitting enter in these little areas here where the cursor is flashing, or you can do this by making this bigger this way. And then that'll show that that patient is currently checked into PACU now. So that's that current check-in location option. Now, going back to the patient level, we're right where we left off. One last thing to show is this patient schedule here. Patient schedule is kind of scary looking. It's just where you can go to correct your documentation. So let's say that you accidentally put the left versus the right arm. In patient schedule, you would look for the abbreviated procedure that you used. Blue means done in patient schedule. And in order to fix that, you would simply click on that, that note and choose to correct it. So let's say we want to go back into the surgery pre-op checklist. I found we did it around 4:30 and I can see it listed here. I'm going to double click and then it gives me that option to correct or supplement. So I'm going to choose correct here. And then it opens up that documentation. So let's say I just want to put a comment of testing. And then I hit enter and or okay, and then I get back to my accept button again. All right, I think I've pretty much shown you everything as far as placing orders, looking up information, making corrections, unscheduled documentation, the importance of that for surgery, also options to trend and observe trends over time. And always, always, always make sure that you close your patient's chart when you walk away. So now if I wanted to close this patient's chart, I choose X. Notice it's giving me a warning, and that's because I opened that general patient education note and I didn't accept it. So this gives you an opportunity to go back and see if you got something open. So definitely go back and find what that is before you choose to clear it if you don't want to lose your documentation. So potential work in progress will be lost. If you still wish to exit, I'm going to say yes. And now we're back to that main screen. One last thing is this website. This will again take you into some different education or medical websites to look up information. This DC reversal will be something you work with staff if you ever have to do it, or us in the future. Surgical services, COVID, this is kind of a new thing, but again, this is using the ED as a setup in the system to use as a kind of a COVID zone. All of these other ones you won't worry about, just these two tabs. Surgical services mostly, and then if we ever run into COVID again and have to move patients around, this is the tab you'd use. This mail here is not your email, so you won't find your email. This is more of a communication within Quadramed. So if that turns red, feel free to look at it, but it is not your email. Always log off properly using this log off key. If you don't log off Quadramed with this log off key, you can freeze your session, and we have to reboot your computer and or any computer you've been on. So always log off properly there by clicking that icon. I hope that was helpful. Thank you.